Have you heard from a number of patients that have said they'd like to use medical marijuana, but they simply can't afford it? And if they can't get help from their insurance, they probably won't be able to afford it.
It's heartbreaking, but we do hear that. Again, we're trying to think out of the box and do everything we can to make sure that the patients who need it can get their medicines.
Are there different prices for different grades or quality of marijuana that patients have different price options?
We believe we have the best quality medication, and we believe in affordability. So it's a company philosophy.
A number of lawmakers, including Assemblyman Billy Jones here in the North Country, have said that they've had some long-standing concerns, primarily that the program is too expensive for many of the people who need it, and that's their biggest issue with it. And that you hear that, and that's something that Albany obviously is still trying to work to solve.
That's true. So again, as I said, we wanted to open up quickly and start helping patients quickly. So we have wholesaled our products, and we've kept our margins as thin as possible in order to make it more affordable. Once we are developing our own medications, we're going to have a lot more flexibility, and I think we certainly should be able to at least widen the patient base.
You have 1,600 now. Do you have a target number that you think you could potentially have here in the North Country in the next few years?
We really don't. I mean, it depends on the expansion of the program. So it's very difficult to say, but we think we have a lot of growth ahead of us.
And where do you see this industry going in the next 5 years?
I think that certainly our company is putting a lot of resources into research, and I think as this research and the clinical trials, the bench studies become available, we're going to be able to see just how important this medicine is.
And the research would look for different ways to use medical marijuana, different options for patients?
Options for patients, disease states.
Are there patients that have a hard time coming to you and seeking medical marijuana because federally it's still against the law? Is that an issue for some patients where they just can't get by that?
I think there is. I think there's some percentage of the population that is concerned about that. Again, you know, we try to truthfully answer everyone's questions, and I think should it become federally legal, that certainly will make a difference. It'll certainly make a difference to the insurance companies, and that'll be probably the biggest change in the industry.
Is the hope that maybe a few years down the road, or is that still too big of a hurdle to protect?
No, I think it's a hope. I do. We'll see.
You've mentioned you've quadrupled the number of patients here in the North Country. Have you added hours and staff accordingly as you've grown here in Plattsburgh?
Yeah, we did. So the facility that we took over was only open 3 days a week. We're now open 6 days a week, and we have late hours as well to help people who work shifts and just to make sure that we're there for them.
And how many employees do you have here in Plattsburgh?
We have 12.
And do you see that expanding or growing?
Absolutely. Absolutely do.
Have you only focused on medical marijuana in all the states that you're in, or in some of the states are you involved at all in recreational marijuana?
We operate one small recreational operation in Oregon. That was the purpose of that initiative was for R&D, and so that's where we are.
Do you see that potentially, though, applying to New York if they legalize recreational marijuana, or any of the other states where you're located?
It's hard to say. New York's a very different place. So I think we're going to have to take a look at the regulation, and we'll see.
And in Oregon, is it a combination of state-run dispensaries and stores and private businesses? I'm not familiar with Oregon.
They're all private.
They're all privately run
private,
in Oregon.
Yep.
And in New York, we anticipate that it would probably be privately run businesses.
Correct.
And
no doubt.
It would be taxed in New York. The state has made no
adult
bones.
use would be taxed. We expect that medical marijuana would probably be tax-free.
As it is now.
Certainly, certainly a preferred tax.
But when New York talks about legalizing recreational marijuana, in the same breath they're talking about operations where they would be able to generate millions and millions of dollars in tax money to help the state.
Yeah, I mean, it's certainly an interest of the state, understandably. An adult use market would certainly generate significant tax revenues.
For people who have thought about medical marijuana, maybe considered it, but aren't so sure about it, what would you say to them to tell them that perhaps it's something they ought to at least consider, if not try?
To call us. There's a lot of misinformation out there, and I would urge them to stop by and see us, to call us, to talk to our pharmacists, and they'll answer all your questions as clearly as they possibly can.
What's some of the biggest misinformation out there?
Well, there's, I would say, addiction rates. Some people believe that there's a high addiction rate. Medical marijuana is a palliative medicine. It's not curative. I think there's some misinformation out there that medical marijuana cures some of these illnesses. There are studies to suggest that there are curative properties, but they're not determinative now. And I think we need to be very clear that this is palliative medicine.
Michelle Bodner, thank you very much for taking the time to be with us. We appreciate it.
Thank you, Tom.